the down would come up. Stop. Good. Stop. 1, 2, 3, 4, 5. Good. 5 deep breathings. Relax. Sit down. 5 deep breathings. You have to do that's very simple. It's a simple Talasana, but you're not going to go. So inhale. So stretch it out. Stretch it out. Completely stretch it out. Stretch up your whole body. Come down. Okay, just come on your toes. Stretch up your entire body and come down. Inhale. Stretch it out. Stretch it out. Stretch up your entire body. Right from your chest to your toes. Every part of your body has to be stretched. Relax. Don't squeeze your shoulders. Keep your shoulders and spine straight. Completely out. Inhale. Take it out. Stretch it out. Good. Exhale. Come down. Again inhale. Stretch up your whole body. Exhale. Come down. Inhale. Take it out. Exhale. Come down. Inhale. Patient was the Talasana only. Skull. Piriya Talasana. Stretch it out. Push your body. Push your hips down. Stretch it out. Come on the other side. So one on left, one on right on your toes. Okay, come on. Start. Inhale. Stretch it out. Now turn to your right. Push your hips down. Push it down completely. Stretch it out. Exhale. Come down. Up. Release it. Again inhale. Stretch it out. On your toes entirely. Come towards your right. Push your hips down. Push it up. Come down. Push yourself more. Come up. Release it. Again inhale. Stretch it out. Exhale. Come down. Come down completely. Come up. Inhale. Exhale. Come up. Release it. 2 more. Inhale. Stretch it out. Exhale. Inhale. Exhale. Come up. Release it. Last one. Take your legs, stay about 3 feet apart. This is called Kati Chakrasana. So you're just going to take your left hand on your right shoulder and the right hand would be at the back. Now inhale here, exhale and turn your body completely. Come up, change your hand and turn on the other side. Okay? So one on your left, one on your right. Every time as you change, you are going to change your hands also. One start. Inhale, exhale, turn completely. Good. Inhale, exhale, turn your waist. You have to keep your hands on your shoulders. Okay? And hands at your waist. Good. Turn your waist more. Inhale, exhale, turn your waist more. Look back. Good. Inhale, exhale. Very good. Inhale, exhale, inhale, exhale, inhale. If you remember it, remember the side on which you have kept your hand, that side only you have to turn. So if I am keeping my shoulder here, I won't turn this way, I'll turn this way.
No, inhaling and exhaling.
Inhale is always center, exhale is at the side. So this is inhale, this is exhale. Again this is inhale, this is exhale. Sides always exhale. Center is inhale, sides is exhale. If doing forward and backward, backward would be inhale and forward would be exhale. If you go back and forth, backward would be inhale and exhale would be forward. Okay, come on, close your eyes, 5 deep breaths. You gently open your eyes and now you all have to do Anulom Vilom. I hope everybody knows what is Anulom Vilom. Close your right nostril, and when you inhale, inhale through your left nostril. So you inhale to the count of your ratio of inhalation and exhalation would always be 1:2. So that means if you are inhaling 4 count, your exhalation would be 8 count. And where you exhale from the same nostril you inhale and exhale from the opposite nostril. Come on, close your eyes. Close your right nostril. Start breathing in through the left. Exhale from the right. Close left. Release it. Important role in arresting your problem of hair loss. Now we have done the whole sequence. I have to tell you what way this exercise are beneficial for you in arresting your problem of hair loss. Understand all these asanas, like these are 7-8 asanas which I have done, like the whole sequence. The first one was Vajrasana. What was the second one? Padmasana. And after that? After that? No, that was one. We had to go to Vajrasana, Padmasana, and then Bhujangasana. Okay, here Bhujangasana, what did you do? You were turning your neck, not your body. And afterwards?
One leg Vajrasana.
Sorry?
One leg Vajrasana.
Yeah, one leg Vajrasana. That's called the spinal flex. It's called Udru. Udru, that's like normally we call it spinal twist. That's more hard, easy. Okay, then next one, Talasana. Then you have got 2 Talasana. One is the normal Talasana, one is that turning on the side which is called Piriyam Talasana. And then you have got the last one, that was your Pratishtha. What happens when you're doing this asana, the whole sequence? What way you're doing it? First of all, the most important thing is that when you do this whole sequence, you stimulate your kidneys. Okay, and what is the function of your kidneys? To throw out the toxins from your body, right? Second thing, when you're doing your Bhujangasanas and your spinal twists and your Pratishakrasanas and all, is stimulating your adrenal glands also. This adrenal and the thyroid glands are responsible for more or less in ladies your hair loss is mostly due to the fluctuation in your thyroid level. It could be hypo or hyperthyroidism. It does not matter. But in both the cases you have a substantial hair loss. And in male, the hair loss is basically, apart from if you do not have a genetic hair loss or some sort of a thing, it is related with your adrenal malfunction. So when you are doing this sequence, you are tackling the hair loss, which could be maybe in males it could be because of your not proper functioning of your adrenal, and in female of your thyroid. And generally, whatever the problems we have in the hair loss, they are associated with your eliminatory blockages also. We have taken one program, a general program, where you are seeing that your elimination or your excretory processes are really regularized, or you are smoothly taking care of it. Second thing, that whatever is the hormonal disturbances that you are having, that also you are tackling. Okay, apart from that, the first and the foremost thing that you need to consider, you need to keep in your mind is about the scalp hygiene, which you are already familiar with. Okay, what way you are going to take care of your scalp. So these 3 points, if you concentrate on, there is always going to be a very, very good result. Because although we are taking a very generalized program, but in that generalized program also, whatever could be tackled without getting into the details of what exactly and all, accidents, trauma and all, the hair loss is like tremendous. Apart from that, if you have a normal, like what we call it like clinical hair loss, this would be the simplest and yet very effective and proven method which can definitely arrest first your hair loss, and if you really be consistent in your effort, you would also see within a period of say like 2 to 3 months, not only you have arrested the problem, but your hair growth process is also started and it is also showing you good results. So many times people say, okay, now you have to, the hair loss has become so much that I need to go for like artificial transplants and now see what one wants to go for. That's obviously your choice. But understand one thing, as we were discussing it earlier and we discussed it today also, every square inch of your scalp has got about 38 sweat glands, and every square inch has got something like 1,000 strands of your hair. So when you have a very severe hair loss also, normally we say like during the period of say 30, we are not talking about very early or very late, like after 60s and now we are talking on a general platform when you're talking about the hair loss, that's between 30, which is like too early according to the earlier generation, because they used to have this hair loss maybe after 45s and during the time of say when you're reaching to your senior or your older generation to your 50s and all. So during the like from 25 onwards till 35 or like 40s when you're experiencing severe hair loss. So earlier it could be like say something like 35 and 40. Now if you say now my hair loss is really too big, so it may be coming out to say about like 80 to 100. Strand is supposed to be the most damaging hair loss in the clinical languages, in the clinical trial form. But understand, even if you are losing 100 or 120 strand, the methods or the procedure or the food or the points which I have been talking to you about, if you can tackle that, you got out of 1000, if you take the 100 hair out of it which you are losing, there is always a chance of 900 hairs to regrow and to again come totally naturally without taking the help of any other artificial measure. The only thing that may stop you, I don't think that can stop you, because even if you're going for the artificial process, that is a long laborious process and there is a serious pros and cons about it. Well, I would not discuss that because that's not my topic. But after that also there is quite a few, you can say contradictions and you can say the side effects and all which you exerting. Whereas this is relieve and elevate the stress out of your life, and you just follow a program. Like if you're just going a hot shower treatment or maybe just taking care of your scalp, like in a general hygiene routine, like warming or using a medicated herbal oil or simple oil, could be something like a olive oil or sesame oil. Don't use any oil which is being scented. The scents are not good for your hair. But many people say many Ayurvedic oils also do have scents. If you have these scents as something like a camphor or a jatamasi, or there are certain herbs which have got a very pungent and a very predominant smell, that's different. But anything else apart from a natural smell, if it has got, like when you talk about any of this oils which are available in the market, most of them have got scented with the scents which have been added to. So this scented oil has to be avoided. So if you avoid that and use a natural like oil, like your olive oil or your sesame oils also according to season, that also could be beneficial. I mean something like you don't want to go for very expensive procedure, even something like the castor oil is definitely in a very good position to give you the result for your hair. The only thing is that you got to see, you got to determine yourself and give yourself say maybe on a period of on an average say like 3 times a week, about a duration for 30 minutes, and then you can see the results probably telling you, I have given you the example in my last workshop.